All right, Paul, thank you so much for joining us on the show.
That's a pleasure, Ash.
It's great to have you here. And before we go any further, we need to signpost the day. It is January 31st. It's a Monday. It's sunny outside. And we feel like by the time listeners get to hear this, some things might have changed. So we want to just take the time to call out what day we're on. And Paul, maybe you can paint a picture. What's going on in the industry? Aged care and COVID, this deadly mix. Give us a summary.
So the summary is that we have now had COVID outbreaks in nearly three-quarters of all aged care services in Australia. And when you remember that we actually haven't seen outbreaks to any huge extent in Western Australia, and they make up probably 15% of the aged care homes in the country, that means we're getting very close to 90% of all the homes in all the other states and territories that have experienced a COVID outbreak. And the vast majority of those have been in the last 2 months since the beginning of December, when the Omicron wave has hit Australia. So it's had a dramatic impact. We are now unfortunately seeing a significant increase in the number of people passing away, having had COVID in aged care. So latest count is that that's over 400 people since the beginning of January. So that is a significant toll, and beginning to get up, unfortunately, to the numbers that we experienced in that very first deadly wave in Melbourne, where we had 700 plus people die. So this is another really pressured time for the aged care sector. The impact is particularly severe on staffing levels. So because the Omicron wave and the community transmission around it has been so widespread, we've been looking at anywhere from 15 to 30% on average loss of staff. And in some instances, we've heard figures as high as 50% of the staff being affected, either because they've got COVID or they've been close contacts and been forced to isolate. And of course, the consequence of that has been substantial impact on the delivery of care, both across residential care and home care services to older people.
Wow, you're painting a very dire and bleak picture there, and it's unbelievable to think that in November we were talking optimistically about, things look like they're changing and 2022 is going to be a great year. I've heard that before. Could this not be foreseen, this new wave? Could we not have prepared a bit better?
We could have prepared better, yes. Did we prepare better? Only in some limited areas. So, for example, if we take the vaccine booster program, Targi only finally made a decision to say yes to needing a third injection or a booster at the end of October. By the end of the first week of November the 7th, the Federal Department of Health had started in-reach clinics into aged care homes. Mm-hmm. So we were very quick off the mark, but the plan for that program was a rollout targeting 6-month timeframes for a booster shot. That, of course, changed by mid-December to being 3 months. So there was a need to compress the time frame for the booster rollout. But even by mid-December, Omicron was beginning to overwhelm us. Just to take the outbreak numbers, for example, at the beginning of December, there were only around 30 aged care homes with outbreaks in Australia. As of last week, there were nearly 1,300 live outbreaks in their homes. And as I mentioned, we have now over 1,900 aged care homes that have experienced outbreaks, and a number of those have been in the last 2 months, but they've actually already closed out the outbreak, thank goodness. So the numbers affected from that beginning of December period to now have been close to probably 1,600 aged care homes across Australia. We only have 2,700 aged care homes in total across the country. And as I say, we keep having to remember that WA hasn't had the widespread impact yet. So if you back out 200 odd homes in WA, you can see that the impact across the rest of the country has been really, really good.
Yeah. Now, to stay with the booster clinic program there, a representative from Minister Colbeck is touting a victory here that to date more than 91% of residential aged care facilities have received a booster clinic on site. Is this a victory with the booster clinic, or what's happening with this program?
So we are anticipating that at the end of this week, beginning 31st of January, we will have gone close to having in-reach clinics provided to all of the aged care homes across Australia. Now, if you took Omicron out of the equation, from the beginning of November to the beginning of February, that would be a really good achievement. Getting to every aged care home across the country in a 4-month period would be a big tick. Our problem is that we have, New South Wales yesterday, there were 50 deaths and 31 of them were from aged care, and only 2 of those people have had their booster shots. So I don't think you can call it a victory when you've been overwhelmed and there are, dozens of people dying on an almost daily basis at the moment in aged care as a consequence of the spread of the pandemic. And, that is a tragedy for all those people, it's a tragedy for their families. But the bottom line is this is a really treacherously dangerous disease for frail older people. And once it gets in, even if you've had a booster shot, you can be at risk of really severe illness and potentially death.
Now, going back to the workforce issues here, for people who are working in a facility, either on the service level or management, every day must be a struggle at the moment, and looking towards relief. The idea of Australian Defence Forces coming in is an example is an idea that's been touted as a possible solution. Do you see the Defence Forces coming in as a way to resolve this?
So, Mike Baird, the former Premier of New South Wales and CEO of Hammond Care, was one of the first to call for the Army to become involved. And ourselves, Aged and Community Services Australia, our provider colleagues in the Australian Aged Care Collaboration and the unions involved in aged care all joined together in a call for the ADF to be involved. We made that call 10 days or so ago now. The Prime Minister refused that call. He said that it was not appropriate for the Defence Force to be a backup in aged care. That's a fairly astonishing statement when the Defence Force was involved in the Victorian situation back in 2020. So I don't know how you can claim that it's not necessary now when the situation is much worse and much more widespread than it was in just in numbers of homes affected than happened in 2020. So we're disappointed the government hasn't chosen to activate the Defence Force. We believe they could have helped through their medical corps in terms of some of the care-related issues, and they're also experts at logistics. So some of the issues around delivery of equipment, food, other essentials that are necessary for aged care, which have been interrupted by the supply chain challenges post the Christmas peak of Omicron. We think the Army and the other Defence Forces could have helped. But there are other things that can happen, and the government has been in discussions with the states about activating the private hospital workforce to help out both the public hospital system and aged care. We've been talking with the government about other short-term solutions, so they're making available some of the assessment workforce in aged care to assist on the front line. We've been talking about potential emergency volunteer programs to help out. And most importantly, we in the unions made a call for a pandemic payment for aged care workers. The people in aged care are going above and beyond at the moment. We have people working double shifts, masses of rounds of overtime to try and plug those gaps that are in the rosters at the moment thanks to COVID. And our workforce deserve recognition for that. They deserve recognition for what they do in aged care generally. And of course, we have the broader issue, which we can talk about a little bit later, about where are we going with wages for aged care more generally.
Well, it's great that there are other options to reducing the burden there, or ways to compensate people for the extra work that they're doing. What do you think is behind the Prime Minister's refusal there?
You'd have to ask him, but I think part of the reason is that, in fact, the Defence Forces are part of the general community and would have been as impacted by COVID as we were. So unlike in 2020, when, yes, there was a level of community transmission, but it wasn't at the high levels that the Omicron wave has been, I think the Defence Force capacity to help out was probably as impacted as everywhere else in the sector was. And we did get comments from Minister Hunt and others saying, look, if we called in the Defence Force, we'll be taking, because it would largely be out of the reserve forces, and you would have been taking people away from other essential tasks in the society, including some people in other parts of aged care who are Army reservists. So I can understand the challenge, but from our point of view, this was really, it was critical, and unfortunately they didn't choose to, to activate the Army. We can't control that. That's the decision of government.
Yeah, or maybe part of the call there, or part of the disappointment in not having that accepted, is just, missing the recognition that this is dire and that we need further assistance beyond just the people who are already working in the sector.
Look, I agree, Ash. If they had actually acknowledged that, even made some level of contribution from the Defence Force, it would have acknowledged to people in aged care, this is a crisis, we're treating it as such. So I think even just psychologically, it would have been something that would have boosted the morale in the sector.
Yeah, I could see at the moment that morale is quite low. What do you see on the horizon that might be some respite for people? I know you outlined a few different ideas there.
Well, I think hopefully we've reached the peak of the Omicron wave. Now, we are seeing schools return this week, and there is the possibility that spread through schools will accelerate and we get another peak of community spread. So I don't think we're out of the woods yet, but there is the potential that as the Omicron wave has moved through, we will begin to get staff back. And indeed, some of the statistics from New South Wales Health, for example, are suggesting that that is beginning to happen for the health sector. So they've got much better data across the whole of their workforce than we do across the aged care workforce. But they have seen the numbers of people furloughed due to COVID or in close contacts coming down in the last week. And we're beginning to get that feedback from aged care operators as well. But even if it comes down, the level of community spread in this wave is so much higher than anything we've experienced before that I think we're looking at an impact well into March from on staffing levels in aged care.
Yeah, okay. Now, we had Chris Mammarellis from Widden Care on a couple of months ago, and he was highlighting before the Omicron wave, highlighting that we've had multiple waves, we've had multiple periods of lull in between, and there's been very little in terms of infrastructure or looking at preparing ourselves for the next wave. What can we do in the interim, say that we are peaking at the moment and by March we might regain some sense of COVID normality? What can we do to be ready for the next wave?
Well, I think that the first thing we can do is complete the booster program for residents, but we then have to focus on making sure boosters are available and within all staff. So you might remember last year that we achieved 100% vaccination rate for residential aged care staff, and we were well over 90% for home care staff. Now, that was with the first two vaccinations. We now need to achieve those high levels with the booster program for the staff, so that'll be a priority in the next couple of months. The other thing that is certainly hopeful is that we now have some antiviral treatments that have been approved, and we've been in preliminary discussions with the Department of Health about aged care being a priority for availability of the antiviral medications. So making sure that we can actually roll that out throughout the length and breadth of Australia so that if people do catch COVID in aged care, they can access that medication treatment will be really important. I suspect after that, the key challenge for us really is the staffing one. What the persistent waves that Chris was talking about have shown us is that we don't have resilience in our staffing levels in aged care. The Royal Commission has recommended we move to 200 minutes of care for residents as an average. We currently sit, according to Stuart Brown, at around 176 minutes of care per resident per day. So we need to increase the number of staff in aged care. We need to give ourselves some sort of a buffer for these sorts of extreme experiences. I don't think you can ever buffer against what's happened with Omicron entirely. We would have struggled with the best preparation in the world of the level of community that happened. But there's more we could have done. And most importantly, as I alluded to earlier, we've got to deal with the issue of wages in aged care. We're going to make it attractive for people to work in, which we believe is really valuable, really rewarding for staff to work in, but they need to be recompensed for their work, and we need to stop this ageist approach whereby working in aged care is one of the lowest paid of our workforces in Australia. It's lower than health, it's lower than disability, it's lower than retail, and yet we're looking after the most vulnerable people in Australia, and the people who do that deserve to be paid properly.
Absolutely. Are you expecting any sort of a wave of people perhaps leaving the industry after the difficulties of Omicron?
Yeah, we are getting anecdotal feedback that is happening now. I've seen posts on LinkedIn, for example, from people who've worked in the sector for decades who are just burnt out from their experiences in years. I'm hearing from our members that stress is happening for their managers, for the CEOs. I've had CEOs of aged care organisations really in tears because of their struggle to staff properly and look after the older people in care. This is putting strain right through all levels. Board members are worried about, can they keep going? The responsibilities, the expectation levels are so high. So it's really important that the Aged Care Quality and Safety Commission, the Federal Department of Health and the state and territory authorities understand the pressure aged care is under at the moment, understand that this is beyond anything that is in the control of aged care providers. So simply slapping us all with nets on human resources won't contribute anything to the protection of older people. Right at the moment, we need an approach which is realistic about what the challenges are and brings government together with the sector, together with unions, together with consumer groups to do the best we can to protect older people.
And knowing that we're, facing these challenges, do you believe that increased wages will be enough to bring new people to the sector?
Look, the challenges are beyond wages alone, but if you don't have decent levels of wages for staff, then you can't expect to attract them from other industries, which may be less stressed. So, you have to be able to pay people appropriately. So we, the unions and the consumer groups, agreed with a consensus statement which was facilitated through the Aged Care Workforce Industry Council. It's been submitted now to the Fair Work Commission as part of the work value case for aged care workers. So we're doing our best to come together. But the reality is that aged care providers cannot pay higher wages without the funding coming from government. So that means two things. It means they need to commit to fund the outcome of the Fair Work Commission. We had Anthony Albanese making comments on ABC Insiders just yesterday that suggests that the ALP is coming online with that, which is really important. We also are needing to see the government make similar commitments. To date, they have refused to join in the Fair Work Commission case, despite the fact that there's been a recommendation from the Royal Commissioners that they should, in a tripartite move, join with the aged care employers and the unions in a joint approach to the Fair Work Commission.
Mm. Well, one aspect that might improve communication with the government or the bargaining power of the sector is the coming together of different industry groups. You're going to have to help me here with the language, Paul, but I know that ACSA, LASER, and some other peak bodies are coming together. What's the anticipated outcome of this merger?
So what happened last year was that the Australian Aged Care Collaboration, which includes Aged and Community Services Australia, Living Age Services Australia, and 4 of the major church bodies, joined together with the Aged Care Reform Network to commission a piece of work looking at the future of representation and support for the sector. That report was received late last year from KPMG. And we're taking that forward this year in a piece of work to look at the creation of a new aged care peak body entity to represent providers. So we've already commenced work on that. There's a meeting actually this afternoon to talk about the next steps with that. We're anticipating that there'll be a steering committee established to oversight the work between ACSA, LASER and the other bodies in the sector. And we're hopeful that we will get approval of ACSA and LASER members to create a new entity. It needs to go through that formal approval. The members need their support for this, and so we'll be looking to hopefully have a vote in it with members and confirm their approval.
Sorry, Paul, I lost the end of your sentence there. I think there's a plane going overhead, which is muted, but I heard that up until the point where we had, it needs to go through that process in order
for the members. Yes, yeah. So we're hoping we'll have a vote of the ACSA and LASER members in early April.
Okay, awesome. Well, we had Mike Baird on the podcast a couple of weeks ago talking about this particular thing, and he spoke in a very high level about it. But if you could help translate what this move might mean for people who are working on the front lines, what could they expect to see out of it?
Yeah, look, if we, and this is still subject to member approval, but if we do create a new representative entity, will kick off later this year, it will bring together the resources of ACSA and LASER. It will bring together support from other provider groups across the country so that we can be a stronger voice to government. We can therefore advocate on the issues for aged care much more proactively. We also can provide better member support services if we join our resources together, we believe. And that will mean that practical help in terms of education and training, events for the sector, in terms of government-funded projects that support the sector. We can play an active role in all of those. And we believe we can therefore help the development of the sector, particularly through the transition that will be necessary with aged care reforms that are coming up.
Okay, cool. And do you see any sort of relief for the workforce as well in terms of this might make funding requests a bit easier, or this might make staffing requests a bit easier?
It's hard to tell what will happen directly on the ground because the creation of a new peak entity doesn't resolve in and of itself the workforce challenges for the sector. But hopefully what it will do is by combining the forces of ACSA and LASER and the other organisations in the sector, it means we can focus in on the key issues for the aged care industry much more firmly and in a consolidated way. Workforce will be number one of those, but equally important will be things like sustainability, improving quality in the aged care sector, undertaking successful reform of home care and home support will be really critical. And we also hope that we can provide better support for our members who do retirement living as well.
Mm-hmm. Fantastic. Paul, I'm just about to wrap up here. Is there anything you want to talk about? I can set up another question, or are you okay to leave it?
Probably the only other question that might be worth asking about, Ash, is what's been the impact of the extended lockdowns on residents in aged care. That would probably be worth discussing.
Yeah, fantastic. So, Paul, touching on lockdowns now, we've experienced quite a few of them, depending where you are in the country. I know listeners in WA may not have had so many of them, but for aged care facilities experiencing lockdowns, what's the experience been for residents and for workers alike?
Particularly for organisations in Victoria, where Melbourne had those extended lockdowns, which affected aged care as well, but also in New South Wales and the ACT, we have member organisations that have been in and out of lockdown now for 2 years. And what's been happening with that widespread of Omicron is aged care homes right across the country are being required to go into lockdowns by their local public health units. So what we're hearing from members is twofold thing. Firstly, many of the people who've not experienced lockdowns before are really, so this is members, for example, in South Australia, Tasmania and Queensland. They're very concerned about the spread of the disease and are wanting to make sure that they're as careful as possible. And they're telling me that their residents are often, generally speaking, quite supportive of firm lockdowns because they provide that protection. What's happening for many of the other aged care homes where lockdowns have been extended now for a long period of time is they're finding that the impact on the workforce and the residents is substantial. So trying to manage constant lockdowns, the workers are trying to help residents who've often been asked to stay in their own rooms during the lockdown period. But of course, when you've lost all the staff, how do you help them provide that support? Family members are really concerned about the loss of contact with their loved ones. And this is a substantial challenge for the mental health of older people. So we've had many of our members, particularly in New South Wales and Victoria, who've talked to us about the importance of getting a better balance between what's happening in terms of lockdowns and requirements of older people to be isolated versus trying to do something to maintain their mental health and wellbeing. So we've been working with the consumer groups, the Older Persons Advocacy Network, Council on the Ageing, to actually try and come up with some new guidance that we hope that the AHPPC, the Australian Health Protection Principle Committee, which is the chief health officers from all of the states, might adopt to give new guidance to aged care homes and to particularly public health units about how to get that balance better.
Great. So looking at some other tools instead of just closing everything.
Yeah, so can we do some cohorting within the aged care home, give as many people freedom to move around as possible. If you've got really widespread transmission within the home, absolutely you're going to need to have a third lockdown to try and stop the transmission happening. But in many other cases, preventative lockdowns are being called when staff have been affected, for example. And that's not really in the best interests, we believe, of older people.
Absolutely. It's a delicate balance, and I'm sure workforce issues are a real thing to keep in mind there.
Absolutely.
Paul, we've covered heaps. Thank you so much for your time today. Really appreciate it.